Psychopharmacology. ADHD disorder medication is first line of medication is the stimulants. Stimulants increase dopamine and norepinephrine in the frontal cortex. Most common side effects of a stimulant include insomnia, decreased appetite, weight loss, tachycardia, increased blood pressure, and anxiety. You want to monitor the blood pressure, heart rate, weight, height of the children, and misuse or diversion. Contraindication of the stimulant medication for the ADHD include medication MOA inhibitors used within 14 days. So it has to be more than 14 days between the stimulant and the MAOIs. MAOIs is antidepressant medication, and between the stimulant and this type of medication has to be 14 days. So if the patient is taking MAOIs, you have to wean them off when they have not been taking them 14 days. You can begin prescribing the stimulant, but 14 days has to be in between them. They cannot take them together. Somatic cardiovascular disease. If the patient has a somatic cardiovascular disease, they cannot take stimulant medication for ADHD. If they have, you have to treat that condition before you give them the medication, so they are contraindicated. If the patient or the person is having a glaucoma, it's contraindicated. Hyperthyroidism is also contraindicated for taking stimulant medication. Non-stimulant medication that helps ADHD include atomoxetine, guaifenesin, clonidine, fluoxetine, atomoxetine may take 6 weeks to become fully effective. Stimulants are first line of treatment for ADHD. Antidepressant medications, SSRIs are the first line for depression. Examples include Zoloft, Abilify, fluoxetine, Satropilam. Also, most common second option, that was the first line of treatment. The second line of treatment is SNRIs, or serotonin norepinephrine reuptake inhibitor. Those are fluoxetine and duloxetine. Common side effects include nausea, headache, sexual dysfunction, weight changes, insomnia, and sedation. However, serious side effect of the anti-depression medication, especially SSRIs or SNRIs, the serious side effects include serotonin syndrome, hyponatremia or low sodium, increased bleeding, and QT prolongation. There is a black box warning. All antidepressants carry a black box warning for increasing suicidal ideation and behavior in children and teenagers. Response usually begins within 2 weeks to 4 weeks, but fully therapeutic effect may take 6 to 8 weeks. Antipsychiatric medications first generation include Haldol, flufenate. So the first generation, they have a high risk of APS symptoms, tardive dyskinesia. Second generation antipsychiatric medications, example will be Risperdal, olanzapine, Seroquel, Abilify, clozapine. They have a low risk of EBS symptoms, but they carry high risk of metabolic risk. They increase the weight, they increase the appetite, they increase the blood sugar and lipid. Clozapine, only medication that is appropriate for treatment-resistant schizophrenia. Reduction of recurrent suicidal behavior in schizophrenia or schizoaffective disorder. Clozapine, you have to monitor absolute neutrophilic count, weight gain, lipids, glucose, blood sugar, and myocarditis symptoms, cardiac inflammation. Clozapine have a high risk of granulocytosis risk, and it has a mandatory absolute neutrophilic count monitoring. Anxiety medication, first line of anxiety medication is the SS selective serotonin reuptake inhibitor. That is the first line for anxiety and is the first line of depression. Second line and second option is serotonin norepinephrine reuptake inhibitor. So this medication, they are the first line for anxiety and first line for depression. Benzodiazepine include lorazepam, clonazepam, alprazolam. It's used for short anxiety relief, panic attack, catatonia, and alcohol withdrawal. And they used it for short term only. They have a risk of dependency, follies, memory impairment, and respiratory depression. Avoid long-term use when possible. I have seen patients who come to the hospital for benzodiazepine withdrawal, and they had the symptoms of delirium, psychosis, agitation, symptoms of like alcohol symptoms, like somebody withdrawal of alcohol plus psychosis. So it is benzodiazepine are not first line for chronic general anxiety disorder. They use the only short term. Dementia medications and Alzheimer's disease include cholinesterase inhibitor, used for mild to moderate. Memantine is used for moderate to severe. Their side effects include nausea, low heart rate, weight loss, and dizziness. Donidalorsen is the most commonly prescribed. Sleeping medications such as C drug, they call C drugs. They create the risk of sleepwalking, falls, cognition impairment, dependency. You want to emphasize sleep hygiene first. Mood stabilizers include lithium, valproic, lamotrigine, carbamazepine. So for the lithium medication is the best for classic bipolar disorder and suicidal prevention. You want to monitor lithium level, kidney function, thyroid function, calcium level. Valproate is indicated for mania, mixed episodes, rapid cycling. You want to monitor liver function, complete blood count, and drug level. Lamotrigine is prescribed or indicated for bipolar depression, maintenance, and major adverse effects include Stevens-Johnson syndrome. You want to slowly titrate. Carbamazepine, you want to monitor the sodium level, complete blood count, and liver function. Lithium reduces suicidal risk more than any other mood stabilizer. Natural treatment. Common examples include omega-3 fatty acid, Stevens-Johnson syndrome, folate, vitamin D, and important to know is St. John's worm can cause serotonin syndrome, and can interact with many other medications. So always ask the patient if they are taking supplement. Anti-convulsion medication include lamotrigine, topiramate, gabapentin, and pregabalin. They are indicated for bipolar disorder, anxiety disorder, neuropathy pain, migraine prevention, side effects you want to monitor include extrapyramidal symptoms, treatment of EBS symptoms include benzotropine, diphenhydramate, akathisia treatment include propranolol, and you want to consider also benzodiazepine in selective patients. Tardive dyskinesia, you want to treat felbenzine. Neuroleptic malignancy syndrome symptoms include fever, rigidity, elevated creatine kinase, autonomic instability, altered mental status. You want to stop the antipsychiatric medication, and it's emergencies. You want to hospitalize the patient, support care, consider a dantrolene or bromactine. Those two medications. Neuroleptic malignancy syndrome is a psychiatric emergency. Sleep disorder medications commonly are Hamilton, low dose melatonin. Cognitive behavior for insomnia is considered a first line of treatment for chronic insomnia. Alcohol withdrawal. Medications include naltrexone, acamprostate, disolviram. opioid usage disorder, methadone, naltrexone, buprenorphine. Naltrexone is a fully opioid agonist. Naltrexone is an opioid antagonist and require patient to be opioid free before initiating to avoid precipitated withdrawal. Stimulants are the first line of ADHD medication. Atomoxetine is not controlled substance. Selective serotonin reuptake inhibitor are the first line of depression and most anxiety disorder. Antidepressant medications require several weeks for to be fully benefit. Clonazepam is indicated for treatment-resistant schizophrenia. Haldol commonly causes EBS symptoms. Haldol commonly causes extrapyramidal symptoms. Benzodiazepine treatment, acute dystonia. Benzodiazepine treats acute dystonia and drug-induced parkinsomnia. That is benzotropine. Paranol is often the first line of akathisia. Lithium reduces risk of suicidal ideation. Lithium requires monitoring of sodium blood level. Lithium blood level is required. Kidney function is required. Thyroid function and calcium function required for the patient who is taking lithium. Fulbrate requires liver function test and complete blood count monitoring. Lamartine must be titrated slowly to reduce the risk of Stevens-Johnson syndrome or rash in the skin. Dobenazil is commonly used for Alzheimer's disease. Memantine is used for moderate to severe Alzheimer's disease. Benzodiazepines are appropriate for acute anxiety, but not chronic general anxiety disorder, and its short-term use. Cognitive behavior therapy is for insomnia and it's the first line of treatment. Naloxone treats both alcohol use disorder and opioid use disorders. after appropriately opioid-free interval. Methadone is a fully opioid agonist. Always assess pregnancy status before prescribing medication with known viral risk. Always weigh the risks of untreated psychiatric illness against the risk of medication treatment. Thank you for joining me today.